Got 5 minutes? I am Dr. Stephen Knowlton, a family doctor in Reidsville, North Carolina. This video is intended for people, like many of my patients, who do not have a scientific background. Although millions of Americans have been vaccinated against the coronavirus, millions more have been hesitant about getting vaccinated. Hopefully the information I present here will help you to make a decision based on science and not on misinformation. Number 1, vaccines available in the USA, including the Johnson & Johnson, Moderna, and Pfizer vaccines, all target the spike protein and all decrease the risk of contracting the virus and getting seriously sick. Number 2, given the severity of coronavirus infections, companies went all out to develop vaccines to fight these. The federal government went all out to decrease bureaucratic waste of time, which has slowed the deployment of vaccines in the past. Number 3, the FDA emergency authorization of vaccines against the coronavirus did not mean that these vaccines were experimental drugs. Thousands of patients had been involved in scientific inquiries done by these companies prior to emergency authorization. The vaccines were found to be safe and effective, but had not been studied for as much time as was usual for vaccines. Because the coronavirus has been so deadly, the government decreased the amount of time to bring these vaccines to the public. Number 4, the emergency authorization of Pfizer's coronavirus vaccine was given by the FDA in late 2020. Emergency authorization was also soon granted to the vaccines made by Moderna and Johnson & Johnson. Number 5, as of November 2021, the Pfizer-Moderna vaccines had full authorization from the FDA. Again, all the above vaccines were given emergency authorization from the FDA when they first came out because of the deadliness of the virus. Number 6, the CDC evaluated the 100,000 people who had died of the coronavirus since July 1st, 2021. 98% of these people were unvaccinated. Hospital data confirmed this. 98% of people in the hospital in the summer of 2021 were unvaccinated. Number 7, over 193 million people in the U.S. are now fully vaccinated, and over 434 million doses of the vaccines have been given as of mid-November 2021. In addition, millions of people have had a third or booster vaccine. Number 8, over time, the vaccines are less effective in preventing disease, but continue to be very effective in preventing severe disease and hospitalization, even against the Delta variant. The booster makes them even more effective. Number 9, research is going on right now to see if our current vaccines are effective against the Omicron variant. If the virus has mutated so much that vaccines are no longer as effective as they were, then both Pfizer and Moderna can change their coronavirus vaccines within about 6 weeks. These new vaccines, if needed, would cause our bodies to make slightly different antibodies against the new strain of virus. Number 10, our best way to finally control this virus is for everybody, both in the USA and the world, to get vaccinated. Please get your vaccine. Thank you.